Hello and welcome to Chapter 14, the secondary assessment for the EMT. Um, we're going to look at what makes the secondary assessment and some various other things. So we're going to look at the secondary assessment, the body system examinations, secondary assessment of the medical patient, secondary assessment of the trauma patient, and a detailed physical exam. We're also going to look at reassessment, critical thinking, and decision-making skills, and how we can apply those things. So what is the secondary assessment? It's a physical examination. It includes the physical examination, the patient's history, so history of the present illness and the past medical history, and it includes our vital signs. So the difference between a sign and a symptom: a sign is something that you can see, and which is objective, okay? And a symptom is something that that the patient tells you, which is subjective. And reassessment is a continual process in this, okay? So some techniques, history taking techniques. Ask open-ended questions instead of yes/no questions. Don't just ask the patient, well, do you feel sharpness in the chest? Because that's a yes/no question. What does your pain feel like? What does it feel like? Use mnemonics such as sample and OPQRST. Okay. Sample we'll get into a little bit later, as well as OPQRST. Sample is signs and symptoms, allergies, medications, past medical history, last oral intake, and events leading up to the illness or injury. OPQRST is used for pain, and it's onset, provocation, does anything make it better or worse? Quality, what does it feel like? Radiation, does it go anywhere? Severity, on a scale of 1 to 10, 10 being the worst. What is it, rate it for me. And then T is time, okay? We're going to observe, auscultate, and palpate. You cannot do a proper assessment without touching your patient. You have to touch your patient, okay? Even in scenarios, when we go and do our skills sessions, you will have to touch your patient in order to be able to examine them. So body systems examinations, in the respiratory system, the most important determination when assessing the respiratory system is whether or not that patient is breathing adequately. Our history. So for the respiratory system, obtain a history of existing respiratory conditions and any medications that they take. Determine if the medications have been taken as prescribed, and determine if the signs and symptoms of this episode match previous episodes. Because then it gives you an idea of, where that patient is and how that patient is progressing, or, we can start treating that based on those previous episodes. Okay, so the physical examination, we want to know what their mental status is using that AVPU. Their level of respiratory distress. So are they having a hard time work of breathing, or is it, a mild case of work of breathing? What kind of chest wall motion do they have? Is it symmetrical? Is it asymmetrical? Auscultate the lung sounds. What kind of lung sounds do they have? Do they have, gurgling respirations? Do they have stridor or rhonchi or crackles, anything like that? Use pulse oximetry, and then observe for edema, which is just kind of swelling. You can also hear edema in the lungs, and it kind of sounds like a wetness. You can also observe edema in the lower limbs, and then any fever. Okay. For the cardiovascular system, we're going to look at the heart, the blood vessels, the cardiac patient, and the patient in shock or with a vascular problem. Okay. For history, you're going to look at any kind of existing cardiac conditions and medications, signs and symptoms of the episode, description of the chest pain using that OPQRST. So when did it start? Does anything make it better or worse? What does it feel like? Does it go anywhere? Rated on a scale of 1 to 10, and how long has it been going on? Determine specific characteristics of pain. Okay, so we're going to look at when we get into the cardiovascular chapter, we'll look at signs and symptoms of chest pain and various other things that go into the cardiovascular system. So we're not going to get too in depth in it, but specific characteristics of pain would be like a sharp stabbing pain, dull pressure. I've heard patients describe it as somebody sitting on their chest or an elephant sitting on their chest. Okay, so for the physical examination, we're going to look for signs that their condition may be severe. Obtain a pulse, obtain blood pressure, note the pulse pressure, look for jugular vein distension, and palpate the chest. We're going to also observe posture and breathing. Breathing can include problems such as respiratory and cardiac kind of going hand in hand, so you have to figure out which it is and how they divide out. So in the nervous system, we're going to look at their mental status and any signs of dysfunction in the body. Signs of dysfunction include paralysis, numbness, tingling in any of the extremities, unable to move any of the extremities as well. Okay, so in our history, mental status, what's their normal state of mental functioning? Because if the patient isn't normal functioning, would be that they would be alert and oriented times 3 or 4, and their normal state on any other given day is alert and oriented times 2. They may know who they are and where they're at, but they don't know anything else. So we've got to determine what is their normal state of functioning. We're going to obtain a history of neurological conditions. So what kind of neurological conditions do they have? Have they ever had a stroke before? Do they have seizures? Anything like that. And then we're going to also note the patient's speech in regards to the neurological assessment, just because speech could be an indication, slurred speech can be an indication of a stroke. So for our physical exam, we're going to perform a stroke scale, check peripheral sensation and movement, gently palpate the spine, check extremity strength, and check the pupils for equality and reactivity. In the endocrine system, the most common endocrine emergency is the diabetic patient. So history, we're going to look at a history of diabetes or thyroid disease, what kind of medications do they currently take, and whether or not they're being taken properly. Sometimes diabetics are probably the worst on medication compliance, so we just got to make sure that they're taking them correctly and when they're supposed to be taking them. Whether the patient has eaten or exerted energy at an unusual level, and whether or not the patient is sick, and whether or not the patient has taken blood glucose or uses an insulin pump. So for our physical examination, we're going to evaluate the patient's mental status, observe the patient's skin, obtain blood glucose, and look for an insulin pump. The GI system, we're looking for what goes in and what comes out and what it looks like when it comes out. This is part of the job that I just don't like. I don't like vomit. I don't like poop. yeah, it's just something I don't like. So in our history for the GI, we're going to look at their oral intake, their pain, any kind of gastrointestinal issues, vomiting, and bowel movements. In the physical examination, we're going to look at the patient's position. We're going to assess the abdomen, inspect any kind of other parts to the GI system, and inspect their vomit or feces if available. So in the immune system, allergic reaction is most relevant for EMS. Anaphylaxis is typically what we get responding to. Sometimes we'll respond to mild cases of an allergic reaction, especially for kids. So our patient history, do they have a history of allergies? If so, what are the typical reactions like? Symptoms of tightness in the chest or throat, and any medications for an allergic reaction, like an EpiPen or EpiPen Junior, anything like that. Our physical exam, inspect the point of contact with the allergen. So was it on their skin, in their mouth? Where was it? Inspect the patient for hives. Hives are the raised bumps, red bumps that go all over the chest and in the stomach. Typically, it'll start at the core and progress outward to the rest of the body. Inspect the face, lips, and mouth for swelling. Listen to lung sounds to assure adequate breathing. Okay, so the musculoskeletal system, we're looking at medical diseases in the system are rare, and the bones are the most important aspect to assess. Okay. Any kind of prior injuries, does the patient take a blood thinner, and history to determine if a medical problem caused the traumatic injury. So for our physical exam, we're going to inspect for signs of injury, such as deformity. We're going to palpate areas with suspected injury with caution, because we can cause pain when we palpate. Compare sides for symmetry. So we're going to look at one side of the, we're going to look at the left arm. If it's injured, then we're going to look at the right arm and compare them, and see if there's any kind of symmetry going on or asymmetry. Be alert for crepitation. Crepitation is the sound of bones rubbing together in a broken appendage. Assess the patient head to toe if there are multiple injuries or if the patient is unresponsive. Okay, so secondary assessment of the medical patient. Assessment varies depending on the patient's ability to communicate. In a responsive medical patient, we're going to focus on the chief complaint. In an unresponsive medical patient, we're going to focus on the physical problems. Responsive medical patient, we're going to take a history of the present illness, a past medical history, perform that physical exam, obtain baseline vital signs, and administer interventions and transport the patient. So take a history of the present illness. We're going to obtain this from the patient or family and bystanders and ask those open-ended questions. Our chief complaint, why did the patient call 911? Why did they call EMS? What brought us out to them today? Okay. All right, so this is also where we get into our OPQRST. So onset is what were you doing when the pain started? Provocation, does anything trigger the pain? Does anything make it better or worse? Quality, what does the pain feel like? Region or relief, where is the pain? Does it seem to spread or shoot anywhere? Severity, how bad is the pain on that 1 to 10 scale? I'm not a fan of the 1 to 10 scale, but until we figure out something better, that's what we use. And when did the pain start? Okay, so this is our sample. Symptoms, allergies, medications, pertinent past history, last oral intake, and the events leading up to the illness or injury. Okay, So when we talk about tailoring the physical exam for specific chief complaints, important information can be gained by tailoring the history to the patient's chief complaint. Ask questions pertinent to the chief complaint, and use a body systems approach. Focus your questioning and exam on particular body system most likely involved. Now, sometimes you have to also figure out what that patient is, how that patient is reacting to other things. So sometimes they could tell you one thing and think that it's related to one body system, but it could possibly be related to a whole different system. So on a pediatric note, we're going to get on the same level with the child, put the questions in simple language, and gather information from the caregivers. So to perform a physical exam, it's usually brief. We're going to examine areas of concern based on the chief complaint. Okay. Auscultate and listen for the presence or absence of lung sounds. Baseline vitals. Okay, so this is where we take our baseline vitals. It's essential to the assessment of the medical patient because it tells us a lot of what is going on inside that patient. Later assessments, vital signs will be compared to baseline to get our trending. So then we're going to administer our interventions and transport the patient. Remember that a decision for prompt transport for critical patients or those with a specific complaints is part of the treatment plan. All right, so let's think about this. Where would you focus your physical exam on a patient complaining of shortness of breath? Okay, so there's two that we're going to do. We're going to focus on respiratory and cardiovascular. All right. We're also probably going to add in some immunological or allergic reaction, such as anaphylaxis. We're going to add in that just to rule it out, so that way we can, for definite, know that it's not that. Okay, so in our unresponsive medical patient, we're going to begin with our physical exam and baseline vitals. Then we're going to gather history from bystanders or family members and do a rapid assessment of the entire body. So a rapid physical exam is similar to the head-to-toe physical exam for the trauma patient. We're going to assess the head, neck, chest, abdomen, pelvis, extremities, and posterior. We want to palpate. We want to put hands on these patients. Again, you cannot do a proper assessment if you do not put hands on these patients. We're going to check the neck for JVD, and any kind of medical identification devices such as necklaces. We're going to check the chest for breath sounds, the abdomen for distension. So, like a distended belly, like a pouchy, the belly is distended. Firmness or rigidity. Okay, pelvis is the incontinence of urine or feces. Extremities, we're going to look at pulse, motor sensation, so our PMS. We're also going to look at oxygen saturation and medical identification devices. Again, a bracelet, a tattoo, something that may help us identify what's wrong with the patient. And check for our pupils. Okay. We're going to also obtain our baseline vital signs. We're going to assess pulse, respiration, skin, pupils, blood pressure, all those things that we just talked about in chapter 13. And then we're going to take note of any kind of abnormalities. We're going to consider the request for ALS personnel based on their signs and symptoms. We're also going to look at where are we with this patient and what kind of facility is available. Okay, so here in our area at the Lake of the Ozarks, we have a level 3 trauma center. if you're working a BLS crew and your patient needs a trauma center, yeah, you could transport them to the lake, but they're just going to transport them out to Columbia or Springfield. So you could fly them. It probably wouldn't be a bad idea to fly them, especially if you're a BLS crew and you're waiting on an ALS ambulance anyway. Okay. So take a history of the present illness and a past medical history. So if the patient's unresponsive, then you're just going to question the bystanders. Find out if they know the patient's name, what happened, if they saw anything. Was the patient complaining of anything beforehand? And does the patient have any known illnesses or problems? And is the patient taking any medications? So we're going to administer our interventions and transport the patient. We're going to look for signs of mechanism of injury or signs that suggest a spinal injury and immobilize our patient with a C-collar if needed. So what other mechanisms might you have to obtain? What other mechanisms might you have to obtain patient history other than speaking to bystanders? Again, look for medical devices, tattoos sometimes. I know that the tattoos are a big thing, being put on the wrist, that they're, type 1 diabetic, type 2 diabetic, or that they have seizures or something like that. Okay. So the secondary assessment of the medical patient takes two forms depending on whether the patient is or not responsive. You assess the responsive patient by getting a history of the present illness and a past medical history, then performing a physical exam of affected body parts, of affected parts of the body before getting baseline vital signs. Since unresponsive medical patients cannot communicate, it is appropriate to start the assessment with a rapid physical exam. Baseline vital signs come next. Then you'll interview bystanders, family, and friends to get any history that can be obtained. You may not change any field treatment as a result of the information gathered here, but the results of the assessment may be very important to the emergency department staff.